podcast is intended for educational purposes only. For more information and our full disclosure, visit us at ncmidwifery.com and our podcast page. Well, welcome back to More About Birth, Season 2. This is a special bonus episode, a continuation of our conversation with Dr. Virginia Frazer, here with our hosts, Shannon Bennett and Angie Hansen. So let's take a look at this special moment.
Hey, we are here today again for a quick bonus feature with Dr. Virginia Frazer, lovingly known as Ginger. And she's going to share with us, from a naturopathic physician and retired midwife's perspective, how to introduce solids to your baby, when to introduce them, and Angie?
Yeah, that's pretty much it. We're going to hear about what to do, what not to do, hopefully. Mm-hmm. Also important, how to do it safely, and also how to do it in such a way that you avoid later food allergies, because this is huge, and I don't think everybody, especially new parents, understand what causes some of those food allergies. So, Ginger, take it away.
All right. So the handout that we're looking at is titled Infant Feeding. And I don't mean breastfeeding, I mean food.
And we'll put a copy of that on the website.
Right.
For you
so
to
for the
access.
first 6 months, mama milk, or if mama milk is not available, then formula, is all the baby needs. And there's a couple of different signs that the baby is ready to eat. One is they freak out every time you eat because they want to do what you're doing.
Yeah.
They want to know what it's about. They want to check it out. And I think the best way to do that is not to stuff food in their face. It's to put them in their high chair and probably in some ugly onesie or even just in their diaper. Right?
Well,
And you put
onesie.
some kind of smush on their, on the tray of their chair. And so, the first group of foods, right? So, maybe a yam, you know what I'm saying? So they cook it up, they kind of smash it a bit, and then they put it on there. And if the kid wants to get it in their mouth, they're going to figure out how to get it in their mouth. But really, they don't know what that is. They don't know what it's like. They don't know. They want to know. They're going to get to do what mom does. You know what I'm saying? So they're going to check. Your lips and your tongue are really, really sensitive. And so the kid's going to figure out what that is. You know what I'm saying? So they're going to be doing their thing with their hands. Now, so this is not food introduction. This is basically appeasing the kid because they want to do what you're doing. But, and so it's around the age of 6 months or so, but it also has to do with maturity of the digestive tract. I think teeth would happen to be a sign that the digestive tract is mature. The other thing is, if you put some food in their mouth...
You saying if you have to gum it, that you're not ready?
It's like common sense, right?
Yeah. So then if you put it in their mouth and like the Gerber baby, half of it comes right back out again, that's called the extrusion reflex. It's basically it's the nursing reflex, and they're not ready to eat food. So we don't try to stuff food in their mouth just because they are 6 months old and they have teeth. You want them to be able to swallow back.
Okay. What about...
Which is a real thing, right?
Yeah.
It is.
Yeah.
It is. They have to be able to sit up and push the food away if they're not interested.
What
you know
about
what I'm saying?
the old myth? And yes, it's old school, but it's coming back again. I'm hearing it from some of my moms. When do I introduce rice cereal so they'll sleep all night? Do I have to wait 2 weeks or 3 weeks? I'm like, no.
That has nothing. What's happening when you give the grains too soon and it makes them sleep? It's because it overwhelms their system.
Oh,
and it's not healthy. It's really only about 9 months until they get. And at 9 months, I'm meaning the second round of food. If you started at 6 months, for example, that's when it worked out for your kid to start. So that's a general thing. And so what you're looking at is that if they get a rash around their mouth or around their back end, then that's not a good food for them to be having. If they get a slap cheek or windburn look on their cheeks that's kind of dry. That's not a good sign. And then of course, if things get runny on the back end, or mucousy, that's a sign of a problem also. So those are kind of the 3 ones that you would see in little.
So you're going to want to introduce
people.
one at a time,
One
so you know
food at a
what's
time.
causing it.
That's right. One food at a time for several days, and also water should be given between 3 and 6 months. And I like the sippy cups that have, if they're going to use a sippy cup, the ones with 2 handles on it. But I have 3 speech and language development people in my practice, and all 3 of them recommend a straw.
Really?
And they have those flip straws so they don't leak all over your bag and stuff like that. So but learning to do a straw actually helps with lingual and language development.
Interesting.
Oh,
So
that is
very
interesting.
So I'm really shocked that you said water at 3 months.
3 to 6. Yeah.
that
But we're talking
even-
about just to their tongue, like having it around so that they can drink it if they want it. You know what I'm saying?
Just to
So as they
learn
start
to
to
drink.
move around a little bit, and you have it where they can
Okay.
reach it. So
But if they're nursing 100% or exclusively, it's not necessary, right, for hydration?
Oh no, it's not necessary. But you know what? You have to remember that in the summertime, particularly, the babies will heat up, cool down, and dry out 10 times faster than we do.
Mm.
So it's really hard to keep them hydrated
they
completely
have
by
to
breastfeeding
nurse
when
and
you're
nurse
out and
and
about
nurse.
and you aren't wanting to sit there and
Right.
whatever. So right, then you ran out of whatever you expressed and put in a bottle, and so
Gotcha.
you were going to give a little water. So there's the way the lists work. So we're talking about maybe a 6-month start, and then the 3 months into that, the only thing that's not listed in the 9 months that a lot of people want to know about is avocado. So we wait till 9 months for avocado as well.
So what is on the 6-month list?
So 6 months, mother's milk, or obviously formula if needed. Cherries, pitted and smashed.
That's
Banana.
a shocker.
Banana, prunes, blackberries, applesauce, grapes without the seeds, obviously, and then pears, blueberries, carrots, beets, and yams. Now,
Any special order?
no order. That's a group of foods
Okay.
in the 6 months group. And so that's kind of the first bunch of foods. And they're organized by group from the least allergenic to the most
Okay.
allergenic. And wheat is at 21 months. And so I have a little caveat down here. It says, I know that most people don't wait till 21 months for wheat, right? Or certain other things they might see on there, but at least wait until 12 months and don't have it every day. So you have to have, wheat and then do something else like rice or oatmeal or whatever.
And that's going to help prevent like gluten intolerance.
If you rotate, it's always good. We say a variety of foods, right? So don't mono eat or you'll end up with a problem. That's what
a
I
new
say.
term, mono eat.
Mono eat.
Mono eat.
I get that term.
Yeah.
Mono
But
versus
so,
stereo
like, giving the
eating.
I
kid
can't have a spoon
their
of
first
peanut butter
cereal
every day.
as rice cereal and giving it to them every day for months on end probably isn't the best idea.
No. I mean, yes, it's fine, but you start at 9 months. You don't give it any earlier than that because they don't have the enzymes to digest it.
Yeah.
And so then it's just causing their system to overload. And yes, they sleep because they're miserable. And you're gonna and you're gonna be miserable in the long run.
Oh, that's sad.
So very interesting. One other thing that I like to mention is when you have a family who's all dairy allergic, they did a big study of women who withheld dairy during their pregnancy, and that baby turned out not to be dairy allergic. So it's just interesting that because antibodies go across that placenta in the last couple of months,
Right.
last month and a half, they they end up with antibodies of everything you're allergic to. And if you didn't realize you were allergic to dairy and your antibodies are going across the baby,
Makes
then they're
sense.
going to end up with problems.
Yeah.
So yeah, it's kind of interesting. So basically there's other symptoms that older kids will end up with, but basically you're looking at, we're looking at up to the year. So those first.
So what
batches of
about
it.
allergy testing? It kind of goes along with food introduction and reactions. Can you do effective allergy testing on an infant under the age of a year?
I've never done it on infant, at least less than a year. I just tell people back up. If their baby is having problems, I just say back up, and start it back in. Go back in.
Top of the list.
Yeah, start back into the first 6 month route, even if they're a year. You know what I'm saying? If they're having all kinds of problems, go back to the 6 months foods.
Well, I think what we see a
You know?
lot is people, we'll see them later down the road, obviously after their final 8-week postpartum.
So if they're two,
And they're-
if they're over 2, we actually do an adult food panel, not a pediatric panel.
Oh, okay.
Yep. Yeah.
Blood test, scratch test, what?
There's pros and cons all the way down the slate. If they have really severe problems, scratch tests actually can be a problem. They can send them to the ER. I had a lady who had sent her to the ER. Yep, and it took months for her body to clear out. Months.
So if you were to
Wow.
back up, then what would be the process to reintegrate the list?
It depends on how old they are, right? And how
Okay.
much they've been mono eating. So I just basically say, we got to heal that gut. And what are we
Right.
going to do? We just have to back up.
Well, what I'm seeing is people, they get excited to start feeding the baby solids.
Yeah.
And
And-
they'll get like combo baby food containers, or they'll do a new food each day. And I'm like, no.
3 to 4 days at least.
Yeah, you got to have long enough to see if they're going to react.
And
Did your
also,
kids
you
react
think
to
about
that?
if all your food is basically canned, which is what a jar is, you know what
Yeah.
I'm saying? If all you ever ate was canned food your entire life, what would your vitality be, right?
Yeah.
I'm like, take real food,
Yeah.
get it into what they can digest, because if you give your 6-month-old a raisin, guess where it's going to end up? Straight out the other end.
In the blender, right? No.
So,
good.
not your 6-month-old. If you give your, 4-month-old a raisin, it's just going to go straight through it.
Yeah.
They're not going to digest it.
Yeah.
So if you didn't, unless you cooked it for a while or something and got it all soft.
So would you recommend blending or
So what I was going
cooking
to
and
say
mashing,
is,
boiling?
have you seen those little mesh bags that you can put the food,
Yeah.
the chunk of food in, and
They
then
didn't have those when my kids
I
were
know.
little.
But
I
then
love
they can
those.
teeth on it, so
Right.
the frozen blueberries or the carrot or the apple,
Wow.
and then they don't choke on it, and it
Right.
comes through the little. They just chew on it, and it comes through
the
and
mesh.
smush, and so they can't choke on it. Which I think it's nylon, it's inert, it's not going to cause the baby any problems.
Right.
So it's not like pieces of it are going to come into the baby
But
like
when-
Teflon.
When you first introduced solids, the old Ginger.
She's losing it. It's okay. It's a free laughing zone on our podcast.
Oh my lands.
Okay.
Back in the day, I was always told when you first introduce solids, obviously smash them up real good, but add liquids
Yes.
to it, or you'll have a constipation problem.
Exactly. And
Still
bananas are notorious for causing constipation.
And
yes.
every baby
They're
loves
when you
bananas.
have diarrhea, you
Yep.
give them bananas,
Yep.
But anyway, I like real food. So you use, I love the little silicone ice tray.
Ice cube trays,
And you
yeah.
put the food in there until it freezes. And then you pop it out and put it in some container to keep in the freezer. And that way you can defrost a couple of these, a couple of those, a couple of these. And the kid gets a variety of food at one sitting without having, so then they don't have a whole jar to eat of whatever.
Right.
You know what I'm saying? It's
Right.
like,
That's good.
again, mono eat. So basically it's nice because we like to eat a variety of foods, and why wouldn't kids like to?
I think birds have it right, man. They just eat the food, chew it up, get it all just right, and spit it in the kid's mouth. That's much easier than all this processing.
Oh my goodness.
Okay. So this is where we need to have a retraction.
Cancel.
Yeah. Please.
Oh, leave that in.
If you're listening at home,
bleep,
please
bleep,
do not
bleep.
pre-chew your food and spit it into your kids' mouth.
Okay, I want to
hurt
say
'em.
something. This is burning in me. So
Do it.
Uh-oh.
So I just want to talk a little bit more about the baby being ready, like with their teeth, and then like you say, not shoving food down their throat. If they're spitting it out, they're not ready. To talk a little bit more about that, and the reason being because I have experienced this in my own family. And I hear it all the time. The grandparents or whoever gets so excited about this kid needs to eat. They need to eat more, or they just want to because it's fun. Let's give them ice cream. It's their
Yeah,
first food.
yeah.
The baby's never had anything besides breast milk, and the grandparents are wanting to shove ice cream down
Chocolate
their
ice
throat.
cream, yeah.
And as you know, I'm the paranoid mom who's the only one on the planet saying the kid's not ready. I tried to give them this and they spit it out and they choked on it, or I'm not giving them ice cream with
Oh,
sugar
yeah.
and milk for their first food.
I've seen babies, 12, 13, 14 months old that are still solely breast milk because they're just not ready. And then all of a sudden, one day, boom, they're eating everything in sight.
Yeah. So the choking factor or the spitting things out, like that's a real thing, right? Like
Yeah.
that's a real built-in mechanism.
not
So you,
Crazy.
I'm not
you
crazy.
give
You're not
small
crazy.
amounts and you pay attention to whether your kid is interested or not.
Yeah.
Yeah,
And
that's good.
but really, most of the time, the kid's going
Yeah.
at a
Got
certain
excited.
age.
Yeah.
Now, it's really variable where that place lies
So
in
it's
an individual child.
Yeah.
So some
Yeah.
kid may never get to that point because you started introducing food before they started going crazy about your food. So, whatever. I
Yeah.
don't know. I just think it's really makes sense to me that the child would be introduced in,
So
child-led
child-led food introduction.
Yeah, and what about we've talked about pureed or smashed foods with water added. What about the families who are strictly, we're gonna give our kid table food, we're not gonna do there's a whole culture built around that.
The problem is it just comes straight through. If you
Okay.
give if I give 3 green beans to a 5-month-old, they're gonna just come straight through.
Not
They're
gonna
not gonna
digest
digest them. It needs to be broken down a little bit more. So
Okay.
it doesn't need to be overcooked. See, that's the problem.
Right.
If it was a green bean, it's gonna have to be overcooked, and that's not gonna
Right.
give any nutrition. So I just say, do what you got. Is it 15 minutes, Meg?
No.
Oh.
But on a final note there. Oh, perfect timing.
Perfect timing.
What's your
It's
final
that
note?
obnoxious alarm.
People are gonna start tuning us out because of this alarm.
I know. They're like going, okay, who picked that
So
sound?
before
You
we
need to-
wrap it up, I just want to let you know that we'll have these handouts and these things
Information.
on the webpage, nc-midwifery.com. I feel like a commercial. So that you can access them and print them off.
Yeah.
So we will get those up there for you. And thank you again, Ginger, for sharing all your years of wisdom with us.
Yes.
You're welcome.
Thank you.
All right. So that's a wrap again, and we'll catch you guys next time.
See ya.
Thanks for joining us for this More About Birth bonus episode with Dr. Virginia Frazer and Ginger. Thanks for joining us here in these 2 episodes. I hope that you'll join us for future episodes here at More About Birth, both available in audio and video. We'll see you next time. This podcast is intended for educational purposes only. For more information and our full disclosure, visit us at ncmidwifery.com and our podcast page.